Now is Dr. Allison Arwady, Commissioner of the Chicago Department of Public Health. Good morning.
Good morning.
Well, this morning we've been talking about this Delta variant that seems far more contagious. How concerned are you about this as we begin to open up?
So we have detected some cases of the Delta variant here in Chicago. We've actually detected all of the variants of concern here. But the good news is that all three of the vaccines available in the U.S. do remain protective against all known variants, even if the protection drops back a little bit. So as long as we continue making good progress on vaccination, I'm confident we're still in a good place, but we're keeping our eye on it for sure.
So what happens if we don't reach this threshold of 70%? What does that mean for the fall? What does it mean for kids going back to school? Give us an idea.
Sure. So there's nothing magic about the 70% number, but it does represent a goal with a very significant part of adults in particular having gotten that first dose. We're going to keep pushing. It's not like we stop even if we do hit 70%. And really the bottom line is that if we were to see a resurgence in the fall or the winter, for example, it would land in unvaccinated communities and unvaccinated social networks. And so it's less about are we as a city at 70% and really making sure we put additional effort in subpopulations that are lagging behind the rest of the city so there's less opportunity for the virus to spread now or later.
Is there a way to motivate people who are hesitant to get vaccines, whether that's a message or whether it's something more concrete like a vaccination card or whatever?
So certainly there's a range of things that motivate people to get vaccine. We have found there are a lot of people here in Chicago who didn't necessarily say no, but they said not yet. And as they've been seeing more people around them get vaccinated and do well with that, some of them have been stepping forward. We also have a lot of people here who haven't decided not to get the vaccine, but they're not necessarily going to go out of their way to get it. So we're working hard to make it very available for people, knocking on doors, showing up at beaches and parks and schools and churches and job fairs, and you're going to see that throughout the summer. We obviously want to make sure people have the right information, but also ensuring access, especially in less vaccinated areas, remains really important.
Well, we've heard that, at hospitals and at, places like that, they would still want people to wear masks. But what do you tell people when they walk into a store and every store in Chicago has a different policy about masks?
So masks remain required on public transportation, in healthcare settings, and some of our congregate settings. But it is going to be up to businesses, and they're going to be making their own decisions based on conversations with their employees, understanding what their employees' vaccination rates are, recognizing what customers may feel more comfortable with. You're going to need to keep carrying your mask with you. If you're fully vaccinated, the recommendation is that you're not broadly going to need it, but given that there still are a lot of people who are not yet vaccinated, we will see some businesses continuing to require masks for the moment, and we do support that where a business or an institution decides to do that. So we're in this transition phase, but the best thing you can do is get vaccinated, because then in most settings, there isn't even a recommendation for wearing a mask.
All right, Dr. Arwady, thanks for joining us. Appreciate it.
Thank you.
And